What if the sound you love to hate is not destroying your joints at all? In this video, we are testing a belief many of us grew up with, that cracking your knuckles causes arthritis. According to reviews in the Clinical Anatomy Journal, the evidence does not support this old warning. We will show you what actually makes that popping sound, what imaging studies reveal inside your knuckle at the exact moment of the crack, and whether long-term cracking leads to pain, stiffness, or osteoarthritis. Quick disclaimer. This video is educational and is not medical advice. Talk to your own clinician for personal concerns. There is a bonus at the end to help you ease the habit without relying on willpower. Let us begin. Most of us were told, "Stop that, or you will ruin your joints." The story sounds logical, but science says otherwise. According to a case control analysis in the Journal of the American Board of Family Medicine Journal, habitual knuckle crackers did not have higher rates of hand osteoarthritis on X-ray than non-crackers. A concise review in the Clinical Anatomy Journal also states that well-designed observational studies have failed to show a link between cracking and osteoarthritis. If that surprises you, you are not alone. My goal is to walk you through the evidence step by step so you can judge it for yourself and explain it to a worried friend or parent with confidence. Next, what actually makes that loud pop? When you pull a finger and hear that pop, you are not grinding bone on bone. You are creating a tiny gas event in the joint fluid. According to a real-time magnetic resonance imaging study in the PLOS One journal, the sound occurs when joint surfaces suddenly separate and a gas bubble forms in the synovial fluid, a process called cavitation, driven by tribonucleation. The bubble appears at the instant of the sound and lingers for a short time, which is strong visual proof that the noise comes from fluid physics, not from cartilage being torn. Ultrasound work reported in the Clinical Orthopedics and Related Research Journal shows brief bright echoes at the same moment, consistent with a bubble. If this clear, myth-busting science helps you, consider subscribing so you never miss our deep dives that turn scary claims into understandable facts. If you try to pop the same knuckle immediately, nothing happens. That waiting window has a name: the refractory period. According to the PLOS One journal imaging study, gases like carbon dioxide need time to redissolve in the fluid after the first bubble forms, which is why you often need roughly 20 to 30 minutes before the same joint will pop again. Reviews in the Clinical Anatomy Journal explain that this delay is a normal, harmless reset of joint fluid chemistry. The key idea is that a loud sound does not mean tissue injury. It means the fluid momentarily reached a threshold where a bubble could form. Next, we will ask a practical question. What changes in the hand right after a crack? Researchers tested hands before and after cracking to see if anything measurable shifts. According to a controlled study in the Clinical Orthopedics and Related Research Journal, people had a small, short-lived increase in joint range of motion immediately after a pop. That is the loose feeling many describe. In the same experiments, grip strength did not change in a meaningful way, and examiners did not find new swelling or warmth. In plain language, there was a tiny flexibility boost and no sign of damage. This matches what you might feel: a quick release, then back to normal. Now for the big question everyone cares about. Does long-term cracking set you up for arthritis years later? The strongest data points to no extra risk. According to the Journal of the American Board of Family Medicine Journal, people who habitually cracked their knuckles did not show higher rates of radiographic hand osteoarthritis compared with those who did not crack, even after decades of the habit. The review in the Clinical Anatomy Journal reaches the same conclusion, stating that available observational studies do not support a causal link. This matters because fear of arthritis is the main reason people scold you for cracking. If the link is not there, the conversation should shift from fear to smart self-care. But how about frequency and intensity? Does cracking more often change the picture? If cracking were harmful, doing it many times per day for many years should show a clear pattern of harm. According to the Journal of the American Board of Family Medicine Journal analysis, even long-term daily crackers did not have higher osteoarthritis rates, and there was no dose-response signal. The authors looked joint by joint and still did not find a meaningful difference. Reviews in the Clinical Anatomy Journal and in the BMJ, also called the British Medical Journal, emphasize that confounders like age, sex, prior injury, and manual work are the real drivers of osteoarthritis risk. In other words, more pops did not equal more arthritis. So why do a few older papers mention swelling or weaker grip? An older study in the Annals of the Rheumatic Diseases Journal reported that habitual crackers had slightly more hand swelling and a somewhat lower grip strength. But those same participants were more likely to have manual labor backgrounds and other habits that can affect hands. Newer controlled work in the Clinical Orthopedics and Related Research Journal did not confirm swelling or weakness differences between crackers and non-crackers. The most sensible interpretation is that confounders explain the older finding, not the cracking itself. This is why modern studies try to blind testers and use imaging or objective measures. Next, did anyone see cartilage getting thinner or thicker from the habit? A small ultrasound study in the Hand Surgery and Rehabilitation Journal found that frequent crackers had slightly thicker cartilage at some knuckle joints compared with non-crackers. Grip strength was similar. The meaning is uncertain. It could be normal variation, a benign adaptation, or an artifact of a small sample. Importantly, no study has shown cartilage damage caused by cracking. When we stack this with the PLOS 1 journal bubble imaging and the null arthritis results in the Journal of the American Board of Family Medicine Journal, the weight of evidence still leans toward harmless. Let us widen the lens and talk about what actually causes different kinds of arthritis. The word arthritis covers many conditions. Osteoarthritis is the age-associated wear and repair condition that slowly changes cartilage and bone. Rheumatoid arthritis and psoriatic arthritis are autoimmune diseases where the immune system attacks joints. According to summaries in the Arthritis and Rheumatology Journal, these autoimmune types are not triggered by habits like knuckle cracking. The British Medical Journal highlights that osteoarthritis risk clusters around age, genetics, female sex after menopause, previous joint injury, and repetitive heavy manual tasks. Knowing which arthritis we mean matters, because blaming cracking for rheumatoid arthritis or psoriatic arthritis confuses the issue. So what risks can you actually control? The biggest levers are injury prevention and workload management. Reviews in the Arthritis and Rheumatology Journal and the British Medical Journal show that prior fractures or dislocations and long years of heavy repetitive handwork raise osteoarthritis risk much more than any harmless habit. Cochrane Review's journal summaries suggest that staying active and keeping muscles strong supports joint function. That means a thoughtful workstation, healthy pacing of tasks, and good technique for tool use. Instead of fixating on the sound of a pop, focus on protecting your hands during the activities that truly load them. Speaking of the sound, does cracking make knuckles look bigger over time? People often say, "Look, my knuckles are huge. It must be the cracking." But X-ray data do not back that up. According to the Journal of the American Board of Family Medicine Journal, habitual crackers did not have more osteophytes, which are bony spurs, than non-crackers. Reviews in the Clinical Anatomy Journal explain that any brief puffiness after a pop is soft tissue or fluid, not bone growth. So the claim of permanent bony enlargement from cracking lacks evidence. If your knuckles look bigger, it could be genetics, normal aging, or a separate joint condition. Now, what about cracking other joints, like the spine or hips? The pop mechanism is similar, but the context is different. According to the British Medical Journal and the Clinical Orthopedics and Related Research Journal, facet joints in the spine can also cavitate, but those joints bear load and involve nerves and ligaments in a tighter space. That is why guidelines from the American College of Rheumatology advise caution with forceful self-manipulation of the spine. For the small knuckle joints in the hand, painless self-cracking is generally low risk. The rule of thumb is simple. Painless and gentle is okay, painful or forceful is not. Next, when should you stop and get your hands checked? Popping that is painless is one thing. Popping that hurts is another. According to patient guidance from the American College of Rheumatology, you should seek evaluation for persistent pain, warmth, redness, or swelling, for morning stiffness that lasts more than 30 to 60 minutes, and for locking, numbness, deformity, or loss of function. These are signs that something other than harmless cavitation may be going on. Think of cracking as a neutral sound. If symptoms show up, treat those symptoms seriously, not the sound. Next, we will shift from fear to action with everyday hand care that helps almost everyone. Small tweaks add up over years. According to guidance from the National Institute for Occupational Safety and Health, also called NIOSH, keeping wrists neutral, reducing pinch force, and taking micro breaks lowers strain on hand tendons and joints. Evidence summaries in Cochrane Review's journal support task variation and gradual load increases when you type, play an instrument, or use tools. A comfortable mouse and keyboard position, a light grip, and a timer that reminds you to stretch can be more powerful than any rule about sounds. Coming up next, simple movements that nourish joints without fancy gear. Joint nutrition depends on motion. Cochrane Review's journal reports that gentle mobility and progressive strengthening improve comfort and function in hand conditions. The British Medical Journal also highlights the value of therapeutic exercise across many musculoskeletal issues. A quick routine might include finger opens and closes, wrist flexion and extension, forearm rotations, and a softball squeeze, all performed without pain. Warm up before typing, practice, or home projects. These habits support the cartilage and the muscles that protect your joints. If you already have osteoarthritis, what is worth trying first? Start with low-risk, high-value options. According to Cochrane Review's journal evidence, topical non-steroidal anti-inflammatory gels such as diclofenac can help pain with fewer whole-body side effects than pills. The British Medical Journal and the American College of Rheumatology describe benefits from targeted splints for the thumb base and supervised hand exercise programs. Injections and surgery are reserved for selected cases after conservative care. The important message is this: effective care is about load management and symptom control, not about banning a harmless sound. Before our bonus, a quick favor. We have seen that the pop is a gas bubble, as shown in the PLOS1 journal. We have seen that immediate effects are minor and harmless, as shown in the Clinical Orthopedics and Related Research journal. We have seen no higher arthritis rates in crackers, as shown in the Journal of the American Board of Family Medicine journal. If you want more science made simple, please subscribe so the algorithm knows you value evidence over hype. It helps this channel reach people who are still worried without reason. Now for the promised bonus, a practical way to ease the habit if you crack more than you want. When the urge to crack hits, replace it rather than fight it. The American College of Rheumatology suggests gentle mobility and self-massage, which you can do in under 60 seconds. Set a rule. Drink a glass of water, then do a quick hand routine before any pop. The urge often fades during the fluid redissolution window that the PLOS1 journal described. Keep a stress ball or therapy putty at your desk to satisfy the need for sensory input without the sound. If anxiety drives the habit, a brief breathing drill can break the loop. These swaps respect your nervous system and make the habit optional, not forbidden. Here is the truth you can use. According to the Journal of the American Board of Family Medicine journal and the Clinical Anatomy journal, knuckle cracking does not cause arthritis. According to the PLOS1 journal, the sound is a harmless gas bubble. According to the American College of Rheumatology, pain, swelling, or stiffness longer than 30 minutes are the real reasons to get checked. The empowering takeaway is simple. Protect your hands with smart ergonomics, regular movement, and patient evidence-based care. This video is educational and not medical advice. Talk to your clinician for personal guidance. If you learned something today, share this with someone who needs relief from worry, and comment with the next health myth you want us to investigate. Evidence over fear is how we all get stronger.